Hi, I'm Dr. KR Chong. Welcome to my Fertility 101 series, where we'll be discussing common fertility topics, both basic and advanced. So stay tuned. Alright, today we'll be discussing a fairly new IVF treatment called Endometrial Receptivity Analysis, or ERA test. It is also sometimes called a Personalised Embryo Transfer or Window of Implantation testing. I'll be going through some background info on how the test works and also the scientific evidence of its usefulness. IVF has come a long way since 1978 when Louis Brown, the first IVF baby, was born. Over the past 40 years, IVF technology has progressed tremendously, from embryo freezing to PGT or pre-implantation genetic testing, and also to embryo time-lapse monitoring. This is the typical 28-day menstrual cycle. The menstrual cycle can be divided into two halves. The first half, the estrogen is responsible for the womb lining's growth. In the second half, the progesterone takes over and makes sure the lining is suitable for implantation. So what is the endometrial receptivity? This refers to the ability of the womb or the uterus to allow embryos to implant. The period of receptivity is called the window of implantation. The window of implantation is usually between day 19 and day 21 of the standard menstrual cycle. Doctors have been looking at the womb lining for many years. Even as early as the 1950s, tissue samples from the womb or the uterus have been checked under the microscope, and differences can be found during different timing of the menstrual cycle. A second method is using an ultrasound. With the ultrasound, the condition of the womb and the different features can be observed. The latest way of checking goes down to the genetic level, whereby scientists have identified different protein groups which are active during different times of the menstrual cycle. This is called a gene expression profiling. So depending on which groups of proteins are more active, we can actually identify whether the womb is receptive to the growing embryo or not. Based on tests done on 50,000 women, researchers have found out that 30% of women have a displaced window of implantation. What does that mean? It means that in 70% of women, 120 hours is the best time for implantation, which is 5 days. In the other 30% of the women, the best timing of implantation could be earlier at 4.5 days or 108 hours, or could be even later at 132 hours or 5.5 days. So how is this test done? A small sample of the tissue is taken from the lining by a simple 5 minutes procedure. This is typically done during the receptive window, which is about 120 hours if you are using a hormone replacement cycle, or at 168 hours or 7 days after the HCG injection for a natural cycle. This is how a test report looks like. For this particular lady, a sample was taken at 122 hours, and the report mentions that this is the best time for implantation. So for her, this is her personalized embryo transfer timing. The validity of the test is about 2 years, meaning that this test result should be the same if it were repeated within the next 2 years. Earlier this year, the same group of researchers published a study done on 458 women who were doing their first IVF cycle. The women were equally divided into 3 groups. The first group, the ladies underwent a IVF and also tested their endometrial receptivity. The second group, the women did a fresh embryo transfer, and the third group, the ladies underwent a frozen embryo transfer according to the conventional timing. So based on the study, women who underwent the endometrial receptivity test and had a personalized embryo transfer, 70% of them got pregnant within their first IVF cycle, whereas 55% of the women got pregnant using conventional methods. So who should take this test? Any women who is planning to do IVF need to consider doing the endometrial receptivity analysis, as studies have shown that it definitely improves the pregnancy rates. Any women with previous miscarriages should consider this as well, as abnormal implantation timing may also result in miscarriage. Now, for women who has previously done IVF, a possible reason for the IVF failure could be of the womb lining factor. So what are the advantages of this endometrial testing? It helps us find the best time for implantation. And if we were to synchronize it together with a pre-implantation genetic testing, this will further increase our pregnancy rates. The major disadvantage of this test is that the actual embryo transfer will be delayed up to 2 months. In the first month, the IVF cycle, the second month is the ERA test, and the third month is the personalized frozen embryo transfer. The second issue, of course, is the cost. But in my opinion, the advantage far outweigh these few disadvantages. Okay, and there you have it, a brief explanation of the endometrial receptivity analysis. Take care and see you in the next video.